Okay, so, well, that doesn't help, does it? The next section is going to be muscles of the torso. So when I'm talking torso, I'm basically talking from here all the way to here, okay? Just so you know what I'm talking about. So looking at this particular figure, there are several things in here that they point out that are along the torso. So you've got the pectoralis major, for example, which is right there. The pectoralis major is going to flex the shoulder. So you can't see me. Flex the shoulder, bring it up like this, okay? It's going to adduct and medially rotate the arm. So basically this motion and this motion, bringing it in, okay? Because add means to bring together. Here's the midline of your body. This brings this in. And it can actually not just flex the shoulder, but it can help to extend the shoulder out a bit. So next one is going to be the serratus anterior, which there is a better picture coming up, so don't worry. But the serratus anterior basically helps to control the scapula in that it can rotate it and it can protract it. It can bring it back. But it also, serratus, it's along your rib cage, almost looking like a serrated blade, and it elevates your rib cage slightly. Not to the point that you would be going, oh, my rib cage has been elevated, but it does kind of slightly bring that up by pulling on it, okay? Next would be the rectus abdominis. Remember, rectus means straight. So you've got the rectus abdominis right here, and it goes straight up and down. This is what people call the 6-pack, okay, or the 8-pack, depending. This actually, if you look at it, it contracts in the same direction as the muscle fibers. So it does this. Okay, meaning that it's going to compress the abdomen and it's going to flex your vertebra, okay, or your vertebral column. And then finally, within the confines of this picture, you've got that external abdominal oblique. Remember, oblique means it kind of wraps around. And if you look at the fibers on the oblique, it's at an angle. It's not straight up and down. So that external abdominal oblique is going to flex and rotate the vertebral column and compress the abdominal wall and depress the thorax. So it's going to, it kind of does this a little bit and flexing the vertebral column. And because of where it's located, it can actually pull a little and do a little bit of the rotation of that vertebral column. So, looking at this figure, okay, we again have parts and pieces that are not going to be on this practical because it's bones or tendons or ligaments. But like, for example, here, this is a third cervical vertebra. Yeah, we're not going to do that. So the multifundus, I want you to notice that we've got a cervical portion of it here. And then we've got the multifundus down here, the lumbar portion. Okay, so the multifundus extends all the way from the neck down to the lumbar region. And pretty much its job is to extend. So again, remember, extending vertebral column means we're doing this, not this, but this. Okay, and it's going to help with the rotation. Okay. The interspinalis, see where it's in between the spines? We kind of talked about that in the last one with the neck muscles, but it extends the back and the neck because it goes all the way down. It's not just in the neck in between the spinous processes. The semispinalis cervicus, cervical vertebra, remember that? This extends your neck. So remember, extending means to do this. Flexing your neck means to bring your chin toward your chest. Extending means to put your chin toward the ceiling. Diaphragm, okay? Oh, and the semispinalis thoracicus, again, we've got that extension, except instead of the neck, because it's the cervicus, now we're talking about the back, okay? Yeah, the diaphragm. Okay, so the diaphragm is the muscle for breathing. The best way that I can think to describe it is imagine a syringe and you've got a plunger. And as you pull the plunger down, the syringe fills, right? It actually starts to fill with the fluid or air or whatever you're doing. The diaphragm is very much the same. As it contracts and pulls down, it basically pulls down the floor of the thorax, of the place where your heart and your lungs sit, allowing there to be room to expand your lungs, okay? So it's helping you with breathing in and creating more room in the thorax by depressing the thorax floor. Okay. The intertransversarii. Intertransversarii. There we go. This is going to basically laterally flex the vertebral column. Remember, laterally to the side, flex means to bend, right? Flex your muscles. So you've got that kind of lateral flexion going on. The quadratus lumborum here, that big sheet muscle right here. Remember, quadratus means rectangular. It also does that kind of lateral flexion, but something else that it does is it can pull down the 12th rib as well, okay? And if you look, it makes sense because it's attached to that 12th rib right there, okay? Now, going to the other side, the erector spinae. The erector spinae is all of these muscles, okay? And we've been through the splenius capitis, we've been through the semi-splenius capitis, and we did the levator scapula in the last lecture, so I'm not going to go through those, but all of these are part of what they call the erector spinae. So the longimus capitis, that muscle right there, that is going to extend your head, chin toward the ceiling. The iliocostalis, I keep saying cervicus because there's a C in it. It's actually cervicis, just so you know. But for me, being the horrible speller that I am, I tend to pronounce things the way that I see them so that I know how to spell it. So the iliocostalis cervicis, there we go, is actually going to extend and laterally flex and rotate the vertebral column. So we've got the extension, we've got the lateral bending here, and then we've got the rotation, the slight rotation. The spinalis thoracis, again, that CIS is SIS when you pronounce it, is going to be the extension of the thoracic vertebra where your ribs are, okay? The longimus thoracis, again, same thing, extending where your ribs are. You're going to pull yourself up. The iliocostalis thoracis and the iliocostalis lumborum, you've got, again, that extension, pulling yourself up, your back kind of bends, okay? It can flex and it can rotate, and both of them do the same thing. They pull you up, they can flex laterally, and then they can do rotation. All right. So, Hang on one second. Hello. Okay, so muscles are in the abdomen. We just talked about the pectoralis major. The latissimus dorsi actually looks like a big old butterfly wing along your back. When guys do the pull-ups like this, and you see that kind of cut along their back, or girls for that matter, that would be the latissimus dorsi. Okay, so you've got adduction, bringing your arm in, and then you've got kind of that medial rotation as well. And it actually extends, pulls back that shoulder as well. Okay, now the serratus anterior, like I said, if you can see the kind of triangle shape here, that's the serratus anterior that we were talking about earlier. The linea alba is a tendon, so don't worry about that. The linea semilunaris, there we go, is another tendon. The umbilicus is basically where your belly button is, but it isn't something that you need to learn. Excuse me. We just went through the external abdominal oblique, but again, you can see the organization of those fibers is at an angle. It isn't straight up and down. The iliac crest is going to be your hip bone, so don't worry about that. Inguinal ligament, don't worry about that. Inguinal canal, don't worry about that. Rectus sheath is a ligament, don't worry about that. Tendon, I'm sorry. The rectus abdominis, we just talked about that, and the 6-pack or 8-pack. And notice that those fibers are all going straight up and down. So when you do a crunch, for example, this is the muscle that's yanking. External abdominal oblique is still the same. It's just been retracted here. It's been pulled back so that you can actually see the internal abdominal oblique. I want you to notice that the external kind of goes this way. The internal kind of goes this way. Okay, so it's kind of like they're facing a little bit different directions. This also flexes and rotates the vertebral column, and it can compress the abdominal wall. It can bring this kind of in, and it depresses the thorax. It brings it down, okay? The transverse abdominis. Transverse means across, right? If you look at these fibers here, they're literally going straight across. So the transverse abdominis actually compresses that abdominal wall. It squishes it, okay? And then the tendinous intersection, again, is going to be a tendon. So don't worry about that. Now, if you're wondering about the layers, where things are from basically the superficial to the deep, this is a good figure to look at because it'll actually show you where everything is. Everything that's on here is what we were just talking about, but if you want to kind of see, you know, top to bottom where things are, you can look here. Okay, so you got the external abdominal oblique, the internal abdominal oblique, and then the transverse abdominis. Just the different layers isolated so that you can see them better. So let's talk about the muscles of the vertebral column. We went through this with the muscles of the neck, but technically they do affect the vertebral column. So you've got the semispinalis capitis, the splenius capitis, the sternocleidomastoid, the trapezius, the splenius cervicus, and again, this is a bone, so don't worry about that. Again, we went through this during the neck lecture. You've got the splenius capitis, the semi-splenius capitis, the longimus, the interspinalis cervicis, the longimus cervicis, the iliocostalis cervicis, rectus capitis posterior, the oblique capitis superior, the multifundi, which like I told you before, is all the way up and down. It's not just up here in the neck. the semispinalis cervicis, the levator scapula, and yeah, bone. Don't worry about that. Now, here, I want you to see the intertransversarii. See how they are literally on that transverse process from bone to bone. That's a better picture than what I showed you before. The multifundus, again, you've seen it before, but this is kind of a more isolated picture of that. Now, the rotators, see this right here and this right here? This one's new. This actually extends, okay, again, back bend, and rotates the vertebral column. Transverse processes bone. The interspinalis, we've already, I think, discussed, but it extends the back and the neck. So think pull up, okay? And then the spinous process is going to be the nose of the moose or giraffe, or the bifid process in the cervical vertebra. So the muscles of the thorax. So here is that serratus anterior isolated. And literally that's pretty much the only muscle on here. This is the humerus, the scapula, the ribs, which are all the bones. But if you look, see how it looks like kink, 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 like a serrated knife? That's why they call it the serratus. And it's the serratus anterior because the serrated part is coming toward the front of the body. Okay? Now, looking here, we've got the cervical vertebra. We already did discuss the scalenes as kind of a unit, but there are different parts of that. There's an anterior, a middle, and a posterior. And technically, the anterior and the middle pull up, okay? And you can see this on the first rib. So when I talk about elevating the ribs, this is pulling up on that first rib, the anterior in the middle. The posterior is actually pulling up on the second rib, okay? On the second rib. And you can see that point of attachment is on the second rib, so that does make sense. The internal intercostals, which you can see here, okay? The internal intercostals kind of pull. So let me see if I can think of a way to explain it. Think of a bucket handle. And if I pull that bucket handle down, right, it comes closer to the body of the bucket. Well, these are actually inside of your rib cage. And as they contract, they actually take your rib cage and they pull it down almost like the handles on that bucket. The external intercostals, however, and their placement is more exterior. So when you're breathing in, they pull your ribs out slightly. Again, not that you would really, I mean, it's not like severely obvious and you see your ribs doing this like you're a bird. It's not that obvious, but it is obvious enough that if you put your hands here, you can kind of feel your ribs come up just a little bit, up and forward actually. So you've got kind of that up and forward motion. And the external intercostals help with that during quiet breathing, not when we're like running a marathon or anything like that, but when we're just, sitting, breathing, watching TV, or, making dinner or whatever, just a little bit, just enough to kind of make room for our breathing to happen. Let's see. We talked about the diaphragm already. And yes, they go into detail. I don't care that you know that. I just want you to know what the diaphragm is, and it's this big muscle right here. The transverse thoracicus, see this right here? This is the transverse thoracicus. And in really hard, forceful expiration, it actually pulls your rib cage in and helps to kind of collapse it to empty your lungs more. A better picture of that specifically is here. You can see the transverse thoracicus kind of isolated. Again, just to kind of give you a better idea of exactly what you're looking at. So yeah. Now, the muscles of the pelvic diaphragm. So now we're talking about the very bottom here, where your anus and your urethral openings and things like that are. So this would be the male, okay? In the male, you've got, don't worry about the raphe. The raphe is more like a tendinal line. The ischiocavernosus is going to basically compress the base of the penis. The bulbospongiosus is going to compress the base of the penis. It helps with the ejection of urine, it helps with the ejection of semen, and it helps to keep the penis erect during sexual intercourse. Don't worry about the central tendon of the perineum because that's a tendon. Now, the deep transverse perineal, okay, that's this muscle right here. This is going to basically support the pelvic floor. It's going to kind of hold things in place. The superficial transverse perineal, which is here, it's that little muscle right there. This actually helps to fix that central tendon. It helps to keep it in place because we have one on this side and one on this side. It kind of keeps it centered for us. The levator ani, or ani if you prefer, right here. This actually does what it says. It elevates the anus, and again, it supports the pelvic organs. Let's see, where are we? Don't worry about the anus, but the external anal sphincter is actually a voluntarily controlled muscle. We control this muscle. It basically keeps the orifice of the anal canal closed. When we are defecating, when we're going to the bathroom, we relax that very intentionally so that we can go to the bathroom. But it is a voluntary muscle. This is something that we actually control, okay? Excuse me. The gluteus maximus we're going to talk about in the leg because it controls your leg more than anything else. The coccygeus, okay? This forms the pelvic floor and again supports the pelvic organs. A lot of these muscles that are here are to act as a shelf to kind of keep everything supported so that it doesn't all just kind of, okay? Some of them are very specific for what they do regarding the penis because, again, this is the male. But for the most part, a lot of them are just there to kind of support and keep everything where it needs to be. Now, for the female, again, we've got the same sets of muscles. The only difference is instead of us talking about the penis, now we're going to be talking about the clitoris. So everything has the same functions as what you saw in the male, except for the ischiocavernosus, because in the male, the ischiocavernosus compressed the base of the penis. In the female, this compresses the base of the clitoris, okay? And then the bulbospongiosus is going to help to keep, in the female, the clitoris erect and not the penis, is what we saw in the male. So those are the muscles of the torso that I wanted to talk about.